And here we go. All right, so welcome everyone and good morning. Thank you for joining us on this early Friday morning. So we're the Agewell Collaboratory and this is our monthly coffee hour. Elizabeth, if you wouldn't mind going to the next slide. So this event is regarding decreasing social isolation, and we're going to be talking to a number of our community members. So Kate, if you wouldn't mind giving us a little rundown on who we are as the Agewell Collaboratory.
Sure. My name is Kate Clark, and on behalf of Dean Gitlin, I did want to welcome everybody to the coffee hour. Dean Gitlin is the Executive Director of the Agewell Collaboratory, and I am the Associate Director, and I'm also the Director of Strategic Initiatives for the college. And I just wanted to say that we're so appreciative to have this opportunity to meet with our Agewell Collaboratory partners virtually, and to meet with potential new partners who are on the call too. We normally have quarterly meetings in person. We have about 75 folks, organizations in our network, and for obvious reasons, they are not possible. So these monthly coffee hours have been incredibly helpful in reconnecting and connecting with our partners. Just to tell you about the collaboratory briefly, it started about 2.5 years ago. We are a center without walls that brings together our students, our faculty, our practitioners, scientists, and of course community organizations together to look at innovative approaches to address health challenges for older adults and their families. And if you can go to the next slide. We have 4 pillars in our Agewell Collaboratory, and the first I'll start with is the community, because we are working with so many organizational partners, and we do have quarterly meetings. I believe there'll be an announcement, but our next one will be October 6th, and we will be doing it virtually. But we also have a lot of education initiatives where we are trying to infuse aging into the work of our college and our curriculum. And for those of you on this call, we do offer continuing education courses around aging. And we do have a lot of student engagement, and we're trying to find co-op, which is like an internship, co-op sites for our students. So if anybody's interested, please let us know. We have a variety of research projects going on through our Agewell Collaboratory, and with our partners, we like to get feedback on the research, conduct focus groups with our partners, and also to help. They have been incredibly helpful in recruiting older adults for a lot of our research projects. And then lastly, with practice, we translate our research into practice, and we do get support from our community organizational partners with feedback around these projects that take place in a variety of community settings. And we, on our mostly I would say quarterly newsletters, we will let you know about opportunities to engage in some of our practice opportunities. So with that, I will turn it back to Melinda and let the show go on.
Thank you. So as Kate actually indicated, the next Agewell partner meeting is going to be October 6th. The registration information is going to be forthcoming. Next slide, please. So the Agewell Coffee Hour, which is what you're actually here for, is a monthly time where we just gather members of our community from the college and from our student network to speak about a particular topic for that month. So for example, this month, we've reached out to a number of our community members who have been gracious enough to offer some of their time to talk about what they've been doing to decrease social isolation during this time of COVID-19. So as Kate indicated, we have those 4 pillars, and we try to bring the topic together to meet at least a couple of those, but hopefully all of them each time, and to give a different angle. So if we want to invite certain partners that might have experience in the field or in education or in working with students, we would like to offer just a different lens to look at things for. We also certainly welcome different ideas. So if you're interested in ever hearing about a particular topic and our take or our connection to certain topics, please feel free to shoot us an email at agewell@drexel.edu, and we'll certainly take your idea into consideration. Next slide, please. So for coffee hour, we have what we call some little conventions. Overall, we want this to be, if not a casual, at least a very comfortable environment. So we invite questions. At the very end, we will have a Q&A where we invite people to unmute themselves and actually ask our panelists certain questions. But throughout the entire presentation, please feel welcome to use the chat function We invite people as well, if they want to do an introduction of themselves, to certainly type in the chat who you are, where you're from, and just let us know who you're representing and what you're interested in. But please feel welcome to ask any questions throughout the presentation in the chat box, and we'll try to reach them at the very end, as well as offer people to unmute themselves. We do ask that if you are willing to leave your video on, because we enjoy having this be a very just collaborative and friendly environment. If you're not comfortable, or if you feel your environment is distracting, you're certainly not required to. We also ask for the same reason to please, if you're not speaking, to have yourself muted, just to keep background noise to a minimum. Just common courtesy. I am host, so if I catch anyone with their microphone unmuted, I probably will come by and mute you just in case. But please feel just welcome and comfortable in all of this. Same thing, if you're not an expert, you're more than welcome to still speak up. We invite all different levels, students included, to just collaborate with us and communicate with us. So again, if this isn't a casual environment, we still want it to be just very comfortable and very welcoming for everyone. So please sit back, enjoy whatever coffee or tea or drink you may have, and just enjoy with us. Next slide, please. So we're coming to our panelists this morning, which again, we're very grateful to have everyone's time. So at this point, we would like to just offer the chance to do just a short personal introduction with our panelists. So we'll start with you, Karen.
Good morning. Yes, my name is Karen Washington. I am the Assistant Director of Community Engagement at PCA. I've been there for 14 years and have worked with seniors for about 18 years of my career. And I currently am working with senior centers, legal services, and senior employment, and some other small contracts with PCA.
Wonderful. Karima? Let's see.
Karima, I think you are muted.
Let's see.
I'm sorry.
No worries. There we go.
Okay, so starting over, thank you. Good morning, everyone. I'm really happy to be here. Again, my name is Karima Mohammed. I'm the Senior Manager for Resident Services Digital Platforms for Enterprise Community Development. I always say that my career has been right at the intersection of social services and technology. Currently, I am managing the continued growth and development of an online platform and app called Resility. To say a little bit more about Enterprise Community Development, we're a very large, actually the 5th largest in the country, nonprofit affordable housing developer, of which about 46% of the portfolio is strictly senior housing. However, due to naturally occurring retirement communities, our population of 55 plus is almost reaching about 70%. Even though the other half of the portfolio is considered multifamily, we have a lot of seniors. So I'm really excited about joining you today and talking about some of the things that we're doing to reduce social isolation.
Wonderful. Thank you, Karima. And Meg, if you wouldn't mind.
Hi, thank you for having me. Good morning. My name is Meg Kalafsky. I am the program coordinator for the Penn Memory Center. I work on a variety of different programming for them, but I'm here today specifically to speak about our Timeout program, which was historically with Temple and is now a joint collaboration between the two.
Wonderful. Again, thank you three so much for being with us this morning and to talk about the different things you're doing, which are what we've already heard about is very exciting, and we're happy to be able to offer that to tell everyone this morning. Next slide, please, Elizabeth. Wonderful. So at this point, we will hand it over to Karen to talk about what PCA is doing.
Good morning. Yes, and thank you. PCA was created in 1973 as a private nonprofit, and it is the Area Agency on Aging, or AAA, for Philadelphia. Next slide, please. PCA offers services such as care at home, free legal services for older adults, senior employment resources, a prize, which is insurance counseling, Ombudsman, which is assistance for seniors living in nursing homes or other facilities, and Senior Companion, which provides seniors a friendly visit from older adults. We also offer domiciliary care, which I used to call adoption for older adults. It was my easiest way of learning that program, and caregiver support, so people who provide care for older adults. We also have older adult protective services for seniors who are 60 plus to receive care and safety and assistance remaining in the community independently. PCA also offers housing modifications or repairs. And what I'm going to talk mostly about today is senior centers. PCA contracts and runs 2 senior centers, but contracts 26 other centers, so a total of 28 sites in Philadelphia. Next slide, please. Philadelphia Corporation for Aging recognizes the very important strategies that are needed to make sure that older adults have services available to them even pre-COVID, but COVID pandemic has certainly provided a lot of challenges for the services that we offer. So with senior community centers, as I've mentioned, there are 28 in Philadelphia, had to go through a paradigm shift of having seniors coming into the center to access services or going on trips or having resources come to them, meet them at the senior centers, to providing services at home. It was one day we were in the building and all of a sudden we were told we had to leave, and the next day figure out how we were going to provide services. So we definitely had to learn overnight, build relationships overnight, and expand overnight. So senior centers were ready to go. Senior centers that provided meals during the day are now providing grab and go meals. We've provided over 200,000 meals to over 4,000 seniors, which is incredible. We are partnering with community connections such as Food Connect, Easter Outreach. Some centers are connected with their local police, fire, other community organizations to have meals delivered to seniors' homes that are not able to come out or not comfortable coming out to get meals from the centers or go to other places where they would normally go to get food. In those meals, many of the centers are including their monthly newsletters, flyers, census reminders, we can't forget about that, and activities at home. Some centers are providing bags of arts and crafts so that seniors can work on those, and having groups where they can call in over the phone for conference calls to talk about things that they're doing at home. Many centers are also offering virtual programming, so exercise classes, some of our health promotion programs like Walk with Ease are adapting to be virtual. You can also take virtual trips to local zoos or museums or other places. And many centers are offering counseling groups. So they're partnering with organizations like SOWN, Supportive Older Women's Network, or other groups to provide online counseling or telephone conferencing with older adults. Many centers are adapting their programming and having game shows. For example, West Philadelphia Senior Community Center just had a Family Feud game on Facebook, which was really nice and fun to watch them do in a social distancing with PPE present, to have older adults or have their informal supports share with them what's happening online. Many of them are doing birthday celebrations and giving shout outs to seniors so that they're not feeling so alone at home, and many other programs are being adapted. We're also working with community organizations that want to connect with older adults so that the senior centers can help be that bridge. So if seniors still need access to information or new resources that they may not have needed before, the centers are helping to connect them virtually. Next slide, please. So staying connected. The senior centers typically serve about 14 to 20,000 older adults, active older adults in the community. And since they're not able to see everyone, they are making wellness calls. They're calling people once a week or every other week to make sure that they're okay, explore what kind of food resources they have available to them, make sure that they are safe. As we know, with social isolation, sometimes unfortunate situations can happen. Older adults can be neglected or abused, and they're more susceptible to that when they can't come out to see some of the people that they normally would see. So the senior center staff are making referrals to PCA helpline for older adult protective services, and also to schedule assessments if there are seniors who need more services than they may have needed before the COVID-19 pandemic. They're doing nutrition screenings to find out not only if they need access to food, but if they have other needs, like maybe they're having weight loss, maybe they're alone and more vulnerable due to COVID-19, and helping to connect them with resources. They're also doing emergency fund applications. So if seniors need help purchasing groceries or other things that they may need, they're able to explore other resources. Centers are also providing transportation for older adults to get to and from their medical appointments, the grocery store, or to access other things that they need to access with less informals. Some other connections that PCA is doing is Care at Home and other programs that PCA offers, even legal services, senior employment, helping people learn how to do interviews over the phone or virtually. They're providing that assistance. Our community relations department that works with the Latino Advisory Council, Interfaith, and the Asian Advisory Council, they are still providing newsletters, which provides tips for older adults for resources, other activities that are available, and overall self-care. Our senior companion service, which would normally provide older adult visits to visit other older adults, are providing newsletters and friendly calls and wellness calls as well. So many of the services are being offered remotely, and through the wellness calls, they're looking to find out what other needs seniors may have and connecting them with resources. So thank you.
Fantastic. Thank you so much, Karen. And we are moving onwards to Resility with Karima.
Okay, unmute this time. So again, welcome, thank you. ECD, which is the host, essentially, of Resility, Enterprise Community Development, as a housing provider, has what's called Community Impact Strategies Department. The Community Impact Strategies, if you're at all familiar with housing, is similar to any other traditional resident services department, where we do some direct services, but mostly partner with outside agencies to provide services for tenants. We've wanted to, and this is a product that's been in development for about 3 years, to really leverage technology in our communities to be able to go beyond that direct service and be a handheld resource in the hands of our residents and community. Obviously, there are challenges there when you talk about the senior community. I can talk a little bit about that later, but as a result of COVID-19, we've made some significant advances to the technology, quickly recognizing that our seniors did not have access to smartphones and mobile phones. So we have Resility Voice and Resility Text. We've added that technology. If you can go to the next slide, I can kind of talk a little bit more about what Resility is. Again, it's a free mobile app that allows users to engage, connect, and thrive in their communities. That is the goal. It's a platform where partners get on the back end. They can push their information out. So PCA or whatever other organizations have ongoing meal delivery programs, whatever shifts they're making during this time to provide resources in the community, we share that out on the mobile app in what's called our feed or our bulletin board. Everyone can get on. They can actually join groups. We have a senior group that we're trying to get folks on and connected and chatting. It's like your traditional chat group. Some of the outreach that we've done recently, especially in response to COVID-19, we're doing wellness calls. We established a Resility hotline. We partnered with 211 worldwide. We have a 211 button on the app. Within the first 7 days of that going live on the app, we had 100 and I forget the exact, it was over 100 taps on that 211 button, so that because especially for our seniors, we know that they like to talk to a person live. They don't like to search through mobile apps or even search the internet. So that button allowed them to go directly talk to a person 24 hours, and any day of the week, any time of the year. We've also developed a program called We Care Wednesdays, where we're pushing out material, pushing out information on the app specifically for our seniors to help them stay engaged, stay connected. I mean, it might be something as simple as, seated exercises that we share out, or just go out and take a walk, encouraging them to get up and do something. It might be a puzzle, and then turn it into your property manager for, entry to win a gift card. Things like that. We've continued our opening our food pantries with social distancing, our meals delivery, our Grocery Plus programs. We also have bus transportation at some of our locations using social distancing to keep them out and engaged. It might be a trip to the store, it might be a trip to a park, but particularly we're trying to get them to the store. That was a issue initially. We have established some walking clubs with, 4 seniors go out, walk every Tuesday or Wednesday. We've encouraged property managers to kind of coordinate that, make sure they're social distancing, but encouraging that get out of your unit and do something. We also instituted more recently what's called Resility Day, which is the second Friday of each month, where it's sharing resilience with Resility. And we thought that this would be a great opportunity to get our seniors on Zoom and actually share out their stories with the entire community. So we invite children, they're at home. That's actually a picture of Mr. Jimmy at one of our properties in Washington, D.C., who was a Vietnam vet. And he was able to share some of his experience, especially in light of some of the racial tension about coming back to, the United States after Vietnam and those experiences and his experiences with housing. You can go to the next slide. So just to give you a kind of overview of how this technology could work in this space, here's some of our capabilities. I already mentioned the bulletin board. So we share out information about our COVID-19 updates, definitely food pantry distributions. We were working like around the clock as trying to stay at the pulse of the community because churches, around the corner from some of our properties were giving out toilet paper. We wanted to let our residents and our communities know about that. So that is through the bulletin board. We've also, it's a platform to poll and get feedback. So we wanted to know, how are you doing? It's hard to be able to, especially when we have these closed communities, we really want to understand, how are you feeling isolated? Do you feel alone? And some of our initial feedback was yes. And some of it was, I was already alone, which was also concerning, so this didn't really change my situation. I didn't get out much. My children live in, New York. But this also was a tool for us to really stay in touch and keep a pulse. So we did a $25 gift card, drawing each week for those who filled out their COVID-19 survey, and we're able to push those out into the community, which encouraged engagement on the platform. As I mentioned, there's chat and message. So as a partner, if you're a partner on the platform, you can send out information and open up for chat and engagement on the platform with anybody. So we saw that increase in the last few months of COVID-19 as partners engaged, especially among our senior population. You can turn on as a partner or as a housing provider this help request functionality. So we saw that increase where you can raise your hand and say, I don't have enough food. We also had, as I mentioned before, a Resility hotline. I got calls at 4 a.m. in the morning about not being able to get to the store. One of the things, didn't have money. I have money. I want to just be able to get to the store. I don't have anyone to take me. And then lastly, QR codes. This is less useful now because this is more for in-person, but it does help us track some of the engagement with our online events at this point. So share food distributions for those, you can say, I plan to attend. And then on site, if there is a person on site with the Resility, you can actually scan that QR code and track their attendance. So I'll end there. I think that's my last slide. Yeah.
Fantastic. All right, thank you so much, Karima. All right, and on to our last panelist, but certainly not least, is Meg talking about the Timeout Program.
Thank you. We can actually just flip to my first slide if that would be all right. So the Timeout Program is something that's been in the greater Philadelphia area since about the 1980s. So historically what that looked like was we would take college students and bring them into older adults' homes with the objective we have a couple different objectives. One was to really support the caregivers and the individuals in the family with whom the student was spending time with their older adult, giving them an opportunity to kind of go off, take care of things that they might need to while their loved one is receiving, some engaging respite time. And so, obviously some of the objectives of that would be to decrease kind of social isolation while kind of meeting people in their homes and where they're at, as well as on the student side. So we're looking at opportunities for them to explore new career paths, to make positive impacts in their community, and to reduce their also, potential social isolation. With the COVID, we had to pivot a bit. Obviously, bringing individuals into each other's homes is no longer something that we can do, but we recognized that the need was still there, that caregivers still needed a break, that college students still needed opportunities to kind of learn, explore, and grow on their path. And we realized that older adults, more so than ever, were experiencing social isolation, decreased stimulation, and just, I think in general, a lot of us are probably experiencing a little bit less fun than we've been having. So one of the big things with Timeout really is just having a good time together. And so that's what we're looking to bring. So we pivoted to an online model. And so we now have college students meeting one-on-one or potentially in small groups with older adults. And they're spending, an hour-ish a week just connecting, enjoying each other's time, reaping the benefits of an intergenerational relationship. And, just as I said, kind of having fun. That really is kind of a big piece of our program, is that we see that fun is something pleasant, but it also has some really positive health, mental and physical health benefits. If you could click to the next slide, that'd be great. And so joining is a pretty simple, straightforward process for most people. Just filling out 2 applications, and then for the students, there's a training process that's both, kind of asynchronous and in person. And so then all they kind of do is complete those steps, and they're able to be matched with a family. Likewise, on the family side, we meet with the family beforehand so that we can just learn a bit more about them. One of the pieces that we really emphasize in this is we try and make meaningful matches, and what that means is, we try and find similarities to make the intergenerational relationship something that's really natural and fluid. So an example I normally use is we look for someone who, maybe they both enjoy music. It might not be the exact same type of music, but kind of finding that commonality really allows for these relationships to be organic and to feel like, just kind of spending time with a friend. And as I said, kind of on top of the obvious positive benefits of that intergenerational relationship, the opportunity for the caregiver, even for an hour, to just go spend time by themselves, or take care of an errand or a task that they may need to, is really beneficial. Considering that this program is now joint between Temple and the Penn Memory Center, we do have a lot of individuals with dementia who participate in our program. It's certainly not exclusively for individuals with dementia, it's for any older adults. But we found that a lot of older adults and their families who are experiencing dementia have even kind of sometimes compounding pieces to their ability to engage, access, or just kind of get stimulation that a lot of us other people may be have more access to. So I have some information here if anyone has interest in learning about how to join, or interest in making a referral. You can kind of see that here. And we're also just looking to spread the word, as we said, as I think everyone is, we kind of had to pivot. And so we're just trying to figure out the best way to engage and spread the word about the changes. So thank you.
Wonderful. Thank you so much, Meg. And thank you to all 3 of our panelists so far. Since, as you can see on the slide, there are a number of clickable items on the slide that Meg provided, we will ensure that the PowerPoint does go out to everyone in attendance, just to make sure that you're able to get easy access to these different items and links. Next slide, please, Elizabeth. Perfect. So now we're going to move on to some of our prepared questions for our panelists. We also welcome again for everyone to put questions into the chat if anything has come up that you're intrigued about, whether to all of our panelists or to some individual panelists. So moving on to question one. So question one, Karima, you kind of touched on this a little bit already, but we wanted to ask, what barriers have you identified in the work that you previously described? And specifically, can you tell us how you identified some of these barriers? So any of our three panelists, please feel free.
Yeah, so I'll start. As I mentioned before, obviously being a technology platform from especially some of our older seniors is very challenging. We're dealing with a population that is very low income in some of our communities. They do not have a cell phone. And if they do, it's a flip phone. So being a app, even for those that do have smartphones, is a challenge. How do I download it? I forgot my password. How do I get on when they do want to use it? So we've tried to work at it in multiple different angles. We even started a tech drive in our company. Because as I was getting a lot of calls initially, as we pushed the product out more rapidly during COVID, most of the calls were I do not have a phone. So we quickly shifted to being a voice-only platform. Well, give me your landline number. We created essentially a robocall functionality. So when you share out a post as a partner on the platform about the toilet paper at the church down the street, you can actually provide text that will, it's text to speech that can go out to those that only have a flip phone or those that have a landline phone only, so that they can get that information as well. And it just calls their number, and if it hits a voicemail, it'll leave a message, etc. So we've tried to get them technology. We've tried to add, supplement the technology with ways to kind of work around those that don't have the technology. We are available 24 hours a day for help with the technology. I've spent many hours just trying to get someone to, download it. They really want to engage. That's one thing I've seen over the last year and a half working with this product, that, our highest level of engagement is that younger senior, but all the seniors really want to utilize the technology. They want to engage. They want to, be able to use this particular platform, but their technology in general. We've identified it just because we've hit it head on, even before COVID-19, and it's just been exacerbated because of the inability to directly engage with our senior population. I normally would go and sit in lobbies or go to senior events and just help them through the process. Without doing that anymore, we've tried to, institute obviously Zoom calls, as well as just being available online and pushing out information as much as possible where they can engage on the phone.
Perfect. Either Karen or Meg?
I can certainly speak to it. So for barriers that we've identified, I would definitely say going virtual overnight. Having to learn the tools ourselves, manage also many of us who have children, the children were home. I remember having meetings and kids were jumping around in the background on both sides, and also trying to build relationships with community organizations. So right away for PCA, Easter Outreach stepped up. They called us almost as I was walking out of the door on our last day at work, to say that they wanted to help. They were a collaboration of about 70 churches in the area, and they wanted to help with meal delivery. So I took their phone number, went home, and then from home, we coordinated and collaborated to make sure that the Senior Center Network knew about the resource, working together to develop a system so that senior centers could submit seniors who wanted to have a meal delivery from Easter Outreach, and just the software needed to be developed. So learning the system, teaching it to the network, and getting the word out about the resources virtually overnight. It was I guess, a new definition of fun. And there were many challenges, just even with other resources, trying to figure out, what worked best for the seniors while we're calling them. So many seniors have tablets and phones. Even before COVID, seniors would get these tools for Christmas and then come into the senior center. My daughter bought me this. What do I do with it? And as Karima was saying, it's way easier to teach in person. So trying to teach people over the phone has certainly been a challenge. We're going to collaborate with Generations Online, Toby Dichter and her staff, to develop a pilot program with some iPads PTA was able to acquire to try to connect older adults so that they can access some of this virtual programming. One of the other barriers that I must mention is that there are many older adults, as Karima said, not only have the flip phones, but they have the SafeLink phones, or people call them the Obama phones, and the minutes are limited. So we were able to reach people in middle of March. When we got towards the end of March, people would be out of minutes. And we would have a hard time connecting with them, even to find out if they were okay. And it was very scary for some of them. As we said, the older sometimes can be more affected in situations like this. And then we wouldn't know until the month would roll over. How was everything? Do you need anything? We did have a delivery driver who went out to deliver meals, and there was an older adult who looked out her window and said, "Hey, can I have some of those meals you have? I don't have a phone number and I don't have any family." And so there were certainly challenges like that. That's how we would find them out, that there are older adults that have been isolated. It's exacerbated by COVID-19. So it's been interesting.
Wonderful. Thank you so much. And Meg?
Yeah, so, I think that as soon as we realized what was happening, we thought it was pretty obvious that it was going to be a while before people could meet in person. So once we kind of identified that that was not going to continue, we quickly started to pivot and think about what our alternatives were. It became pretty readily clear that virtual meetings were going to be the modality that this program could continue in. But we were very thoughtful about it. So like the other presenters as well, we were very conscious in making sure that we didn't have kind of tech abilities excluding individuals from needing our services. So one of the ways in which we kind of made sure that happened was we, as the program staff, worked really hard to kind of find activities and engagement opportunities that could be done over the phone. So that way, as long as someone has a connection and has a telephone that they can speak on, that there's kind of no barrier there from them being able to complete it. Another piece that kind of changed is that previously we used paper and online applications, things like that. With the COVID changes, everything went online, but once again, we found ways to kind of pivot and make sure that our consumers weren't being, like unable to access or not able to do a form. We would just kind of speak with them on the phone, go through and take care of that for them. So we just really tried to keep things open and creative so that we, one of the nice things was the objectives of our program actually haven't changed at all. We were able to keep the exact same kind of guiding principles. We just had to kind of take a look at the modalities at points and shift those to make sure that we were still able to meet our objectives.
Thank you. And it sounds like for all three, it's just that flexibility is kind of what it's come back to in a lot of ways. All right, question 2, if you don't mind, Elizabeth. All right, and we're also monitoring our chat box for any questions from the audience as well. I do see Kate has come through a little bit. So at the beginning of COVID-19 and even now, we still do not know how long the pandemic is or would last. So one thing that we wanted to ask is, how have you had to adjust your strategies throughout this time, and as our projection of how long the COVID-19 or the peak of the pandemic will last?
I'd be happy to answer that. I think that actually one of the pieces that we had previously been addressing in this program was that students can only get so far from a given university. So if there's a space in the city where there wasn't a high population of students, it became much more challenging to service that area. And so one of the really unique, cool kind of things that has come out of this is the virtual space in this. And so, obviously, we don't know how long this is going to last, and our plan is in perpetuity to have this remote virtual experience. But then one of the kind of things, and I know in the last question it kind of asked how we're getting to some of these pieces. And so one of the things that our program does to try and make sure that we're really servicing the community and as its needs as it stands is that we have an advisory council made up of students and individuals participating in the program, so that we can kind of get feedback on a real scale, real time, what they're needing, how we're doing, and where we can improve. So one of the pieces when we're pivoting that we really found and we realized is that this is a tool that we can use kind of, hopefully even outside of pandemic times to reach individuals who maybe have less accessibility or are in areas that are difficult to reach, are in, more rural areas or just kind of less public transit accessible spaces. So ideally what we're going to do is really just fold this in and kind of have an additional layer to our program, kind of going forward.
Fantastic. And Karima or Karen?
I can certainly speak to this. As we've said earlier, with senior centers in particular, there were no policies or procedures on how to handle meals leaving the building because they weren't allowed to do that before. So we certainly have had to adjust to that, as well as providing virtual programming. Many of the centers have had to learn the new technology to be able to connect with seniors and staff, and also ways in connecting with seniors who hadn't connected with centers before. So finding out how they heard about the senior centers, how they heard about even legal services or senior employment for those who have had an economic impact because of COVID, and finding out what works best for them and adjusting strategies. So as said before, these will probably be folded in for long-term use.
Perfect. And Karima?
Yeah, so I've talked a little bit about, already, obviously, one of the things I would add to that is, as a owner of housing, we're working on getting Wi-Fi in all of them. Some of them do. We do have Wi-Fi in community spaces, which is great when you're not in a pandemic, but during the pandemic, you close those down because we don't want people to, congregate in those areas. So, not just for this particular product, but in general, for people to connect, like the woman who called me and said, I can't, I don't even have people keep telling me, we'll just order food on Peapod. I don't have a computer. I don't have a cell phone. I can't just Peapod order my food because it's all technology based. So it's getting technology into the communities, figuring out ways to train, to teach and educate our seniors on how to use them. And then, of course, that they have to have Wi-Fi, especially in our low-income communities. So how do we partner with some of these, Comcast or Xfinity and et cetera, to provide that in our communities, ensure that, if they do have the piece of technology, that they can use it.
Fantastic. Thank you so much. We're actually, I think, going to skip over question 3, in part just in the interest of time, as well as actually all 3 of you have kind of hit on different answers for that already in a lot of ways. So we want to go ahead to our audience Q&A just to make sure we have plenty of time for any audience questions, of which Kate asked one, which I'll actually get back to. First, I'm going to go to Tim Hopman, who is the co-founder of Connected Life, sent in a question regarding that they are working to help family caregivers provide more care, even when they can't be with their loved ones. Of course, that means tech, and it has to be easy for seniors. So all 3 of you have kind of talked about this already. Even with easy, though, there is a cost component. And when you think of using tech to help seniors, how do you handle the cost aspect? So I'll either say that, Tim, please feel free to unmute yourself if you have any further context for that question, or if the 3 panelists want to answer now.
Yeah, I'll just very briefly add a little bit of context. The panelists have already talked about smartphones. To make things really easy for seniors, you often need bigger screens than a smartphone can provide. So it might be a laptop computer or a tablet. Any of these things, of course, cost money up front. And then generally, whether we do it or others do similar services, there's an ongoing cost of providing service as well. In this population, very interested in knowing how can people like us help, but also how do you handle the cost aspects so that it becomes accessible to your population?
I can start. I mentioned briefly that we started a tech drive. So we recognize, we can't provide a smartphone for all of our residents. We love to, but it's obviously cost prohibitive. So, but we recognize that we maybe take advantage that we have 3 iPhones, version 8 plus and a 6 sitting around in a drawer somewhere, along with the iPad, 4 or 5. Well, how about we refurbish them and get them out to our seniors so that they can use those technologies. So we started that actually about 2 weeks now. So we have a large footprint. Like I said, we're a large nonprofit organization. On one call, my boss just checked in and said how many people have phones that they could donate. It was 30, on one, leadership team call. So across our organizations, how can we get them in? So, I've set up a system where our organization can mail them in or drop them off if they actually go into the office into buckets. We'll clean them, refurb them and get them out to our seniors that need them. When I get those calls, and I've already sent out prior, like as soon as this kind of hit, 3 phones already to seniors who did not have phones or had a Obama phone that didn't have data to hold anything. So that's how we're addressing that.
Sure, I can certainly speak for PCA. PCA works hard through partnerships sometimes to obtain modes of communication for seniors. So we recently connected with Comcast through their Internet Essentials program, where they provide services for $9.99 a month for seniors who are connected with PCA that are 60 and over. We've had grants in which we've been able to purchase equipment. Many of the senior centers have equipment on hand, and we are looking to do a rollout program through the centers where there are going to be some amount of iPads that are available, and many of them will have a keyboard attached. And we're partnering with Generations Online, who also has many other community collaborations as well, to help older adults learn how to use them. So having it is half the battle. Having the Wi-Fi is another part of the battle, and also comfortability. There are many seniors who have the technology and don't want to use it for various reasons, and many who don't have it and are curious. Part of the benefit is of everyone being home is many seniors have family members who are at home now, who are able to help them get set up. Or we were on one call and they said, hey, Mom, just use my phone. And she got her connected so that she could participate in the call. So that has been a benefit as well. But as far as cost, definitely partnerships, grants, occasionally there are dollars available to purchase equipment. And we certainly do that to figure out how to get it to seniors.
Yeah, so I think that we have a little bit of a different kind of way of dealing with this. So we don't have, kind of the funds or the name recognition partnership to kind of draw in, grants or people, kind of providing additional technology. So our plan instead was to kind of look at where someone's at and try and figure out how whatever they have right now, how to work with them and meet them at that place. So instead of trying to make sure that, if they're having trouble seeing a little phone or that, they're just not feeling engaged that way, then instead we have our students pivot to whatever feels comfortable for them. We've even had conversations about potentially having kind of asynchronous events, so like pen pals, as a way to just kind of feel engaged, have something exciting to do with your time, but not really requiring much as far as resources or abilities. So instead just trying to figure out how to meet them where they're at. But also, like Karen, we found that having family members around has really allowed the technology usage to be much more fluid, especially because a lot of times people who get kind of connected with our program come through from family member interest. A son, daughter, spouse says, I could really see my loved one, feeling more excited and engaged with the opportunity to, spend some time with someone. And then they kind of help facilitate making that happen and kind of seeing what our options are there.
Wonderful, thank you. So we are at our last 10 minutes, which time has flown by. So again, we also invite any additional audience questions, but for the time being, Kate Clark, who is part of Agewell, did send in a question for Karima as well as a question for Karen. So Karima, How can other organizations outside of your network of care get involved and use your app? If that is not possible, can you tell us how you developed that, such as did you hire someone to create it, or was it expensive?
Sure. The app is actually, you can download it now. I encourage everybody to go to their Apple Store or Google Play, and it's R-E-Z-I-L-I-T. I'm sorry, R-E-Z-I-L-I-T-Y. Let me learn how to spell it. Resility, you can download it, check it out. I'd love to have your feedback. You can call me. My contact information was shared out. I can schedule a demo for your organization. We'd love to partner. We have properties in Pennsylvania. If your organization services that area, we'd love to have you on the platform sharing that out. And we do offer it. It is free. So Enterprise is a very large, as I mentioned, ECD is a company of a, is it 4 companies, a family of enterprise companies. So we even have a mortgage company. So it's a large nonprofit organization that funded the development of this product. It's been 3 years in development, initially piloted in New York, and then Cleveland, and then Washington, D.C. We have partnerships in LA and New Orleans. We'd love to have one in Pennsylvania. So please reach out to me if you're interested in learning more about the product and using it for your organization. Did I answer all of the question? It was expensive to develop, yes. But again, Enterprise paid for it. It's been less expensive, and it'll get increasingly less as we get to a place where it has a solid ground with it's continuing to develop. It will continue to be developed and iterated on. As I mentioned, we added Resility Text, Resility Voice, and we're continuing to think creatively about really addressing the senior question, because that is the majority of our population of resident users. Okay, I think I got it all.
I think you
If I
did
missed
everything.
part of the question, then please, I'd be happy to follow up with that.
I think you actually did hit on everything. And like Karima mentioned, her contact information is available in that resource sheet that has gone out to all participants that we will include again when we send out the PowerPoint. So Karen, can anyone over 55 join the online programs like Walk with Ease? Do you have to live in Philadelphia? If yes, is there a website where people can go to look at the options? You're muted, 1 second.
Sorry. Yes, I will say that the best way to find out what PCA has to offer is to call the helpline, which is 215-765-9000. I'm sorry, 215-765-9040 to reach the helpline. Many of the programs are being offered at various senior centers, and it can be best to call your local senior center to find out what they're offering. Or as I've said, through the helpline, they are able to provide information about all the senior centers that are in the city. It could be that one center near you is not offering it, but because it's virtual, you'd be able to access it at another senior center. And the age, I believe, is 60 plus. But again, calling the helpline, they would be able to provide more information about exactly what would be available.
Wonderful, thank you so much. And just to make it fair, I'll come up with a question for Meg real fast, which is are there any particular barriers to entry for interested seniors or interested students to join the Timeout program, such as do they need to be do they have to be in Philadelphia? Is there flexibility to that? Same question for seniors.
Yeah, so we are serving the greater Philadelphia area. Obviously, that's a bit of an ambiguous term, right? Where does that end? So we're pretty flexible. I think North Carolina or like another state might be a little bit of a line drawn, but in general, it is a pretty free and open program. As far as barriers to join, I could see someone, if they were kind of uncomfortable with technology, completing applications and things of that nature could be a little bit more complicated. But we, as I said previously, I have a telephone number, so anyone can access me. And once you can kind of speak with me, we can get you, taken care of with anything that may be problematic. For students, really the biggest barrier that we've seen is that people who have recently graduated are interested in participating, and unfortunately at this time this is an opportunity only for students. But we also have students kind of all the way up. We have a student working on her PhD who's participating, so there's certainly no age limit. It's just that you are engaged, kind of in academic pursuits at the time.
Wonderful. And kind of an additional curiosity, how large is the program at this time? How many seniors kind of are you serving, and how many students?
Yeah, so we're right about 20 students, seniors are matched. We have probably another 20 students in the process or are prepared to kind of begin serving, families, and we're just looking for more families who are interested.
Wonderful. Thank you so much.
Thank you.
We don't have any additional questions at this time in the chat box. So in our final 4 minutes, maybe just close out with a question of, let's go with aside from isolation, which is kind of what our meeting is about, but have you had any other common concerns that the seniors that you work with or the older adults that you work with may have talked about? I know Karen has indicated about just food access, things of that regard, but have there been other concerns aside from isolation that the older adults you work with have talked about?
I'd be happy to answer. So, isolation is the largest kind of concern that we're hearing, but kind of a counterpoint of that, especially that the groups that we're working with, as I said, do primarily have dementia, is kind of the complications in their cognition by the lack of stimulation, by the isolation, and kind of the increase in behavior, occurrences, or just kind of general memory and thinking has declined. So really the engagement piece is something that's so interesting to families, and that, hopefully it's hoping to keep that at bay.
Wonderful. Either of you, other two?
I would say for PCA, I have definitely heard from the senior centers through their wellness calls. They have just identified, unfortunately, some issues that seniors are going through because they are isolated. Many of them are not able to access people who mean them well. So there have been some situations where there's seniors who need intervention. And as mentioned earlier, we have the older adult protective services. So our senior centers are connected to know how to make referrals to older adult protective services to make sure that they are kept safe during this very hard time.
And I would just add in my work, it's been transportation and then actually being able to get to doctor's appointments. And part of it is fear. They don't want to get out. They're afraid that they will get COVID if they get on the bus or use public transportation. But what it's causing is this residual, I'm not checking in as much as I should with my primary care. So again, one of the things that we're trying to do is build a relationship with a company called Teladoc. It's not cheap, but we've put some money aside for telemedicine for our seniors as well. Because this staying isolated is creating them avoiding medical treatment, and that's not good. So I want to share one last, if I have enough time, activity I meant to share that I want to share with the group, which is called we had to share a hug. Of course, we have our multifamily residential property, so we had the children create these hugs, make their hands in a long string, and they were able to share those with the seniors as a virtual hug during COVID. So if anybody has the opportunity and can interact, it is a great activity, and the seniors loved it. Very simple. The children just cut out their hands, colored them in, you put them in a string, give them to the seniors, and they could do a virtual hug from some of the children. So
that's a wonderful, that's a
such
wonderful
a great
note
activity
for us to actually end on. That's a wonderful, just like way to bring it back to a nice positive close in a lot of ways. So we are probably about at 30 seconds left. So I think we have just about covered everything. So I wanted to say thank you again to all 3 of our panelists. We really do appreciate your time and just the different context and the different resources you've made available to us. Thank you to all of the different attendees. We do remind that the Agewell Coffee Hour is an ongoing series. We're not going to be hosting next month in August. but we will be back in September. So if you're interested in signing up to hear about our next topics, please do contact us at our agewell@drexel.edu email. We will be sending out the resources in PowerPoint after we finish. So thank you, everyone. Happy Friday, and I hope everyone has a lovely weekend.
Thank you, you too.
Bye.
Thank you.